Hello, Dr. Dina Kentigan here, and this is the Humor and Health Lecture. Objectives. By the end of this lecture, you, the student learner, will be able to explain the historical perspective of humor, describe the four components, types, and theories of humor, identify the psychological and physiological effects of humor. Historical perspective. Laughter is a complex emotional response to one's environment, situation, and stimuli. The ancient Greeks believed humor was a virtue. Plato believed it nurtured the soul, and he advocated using it as a healing practice. Aristotle believed that laughter arose from the enjoyment of the misfortune of others. Hippocrates believed that good health depended on the balance of the four humors, which included blood, choler, phlegm, and black bile. Henri de Mondeville, a French physician, found that his patients healed faster when they were cheered up by friends and family members. Although studied for many years, it was not generally perceived to have any particular healing effect until 1979, when Norman Cousins published the book Anatomy of Illness. In this book, Cousins described laughter as creating an analgesic effect for pain caused by his ankylosing spondylitis, which is a type of arthritis caused by long-term inflammation of the joints of the spine, typically where the spine joins the pelvis. Since that time, interest in laughter as potential therapeutic option has grown, both in popular culture as well as in scientific research, where the field of psychoneuroimmunology attempts to explore the impact of laughter on our physiology and psychology. Patch Adams is best known for his work as a medical doctor and a clown, but he is also a social activist who has devoted over 50 years of his life to changing America's healthcare system. He believes that laughter, joy, and creativity are an integral part of the healing process, and with the help of friends, he founded the Gesundheit Institute in 1971 in order to address all the problems of healthcare in one model. Definitions. Humor, a quality of perception, perspective, and attitude toward life that enables an individual to experience joy even when faced with adversity. Humor is not the equivalent of laughter. It is not a form of therapy. Humor promotes cohesion, initiates relationships, relieves tension during social conflict, and can be a means of expressing approval or disapproval of social action. Laughter, a physical expression of humor, a distinctive stereotype pattern of vocalization that is easily recognized and unmistakable. In some instances, laughter is appropriate. Play, a spontaneous or recreational activity performed for sheer enjoyment. Gelotology, the science of laughter. Human and laughter therapy, a humorous and amusing intervention used by healthcare professionals with the client designed to benefit the client. Four components of humor. The four components of humor are social context, cognitive perceptual process, emotional response, and expressive component. First, let's talk about social context. This context stems from the perspective that humor is basically a social phenomenon, since people laugh and joke more often when they are with others than if they are by themselves. Cognitive perceptive process. Humor is also characterized by particular cognitive processes. To mentally process information from their environment, memory, ideas, words, or actions, people generate with comments or comical physical actions that others perceive as funny. Emotional response. Humor activates the brain's limbic system and causes people to respond in emotional ways. Expressive component. Laughter and smiling are the expressive components of humor. Types of humor. Hoping humor. involves the ability to hope for something better, and it enables to cope with difficult situations. Coping humor involves laughing at hopeless situations. Parody is a type of humor that closely imitates something or someone for a comical effect. Satire is similar to parody, but it is the written or dramatic expression of personal, political, and cultural quirks and flaws. Slapstick comedy, which is one of my favorites, is a type of humor that was common in the days of vaudeville, while physical body movements generated laughs. Absurd humor unites two or more concepts resulting in a ludicrous or ridiculous perception. The picture that I have on the slide is an example of absurd humor. Transformation takes well-known sayings and makes them humorous. Entendres use wordplay to give double meaning to expressions, usually of sexual nature. The movie Shrek is a good example of this. Black humor provides protection from a situation. Healthcare professionals often use this to combat compassion fatigue. Irony consists of two concepts that, when paired, have the opposite expected outcome. Dry humor, or quick-witted, is clever humor that may involve double entendres. Self-depreciation humor is directed at oneself. Puns are plays on words, usually involving homophones. Bathroom humor utilizes bodily functions or parts to elicit humor. Sarcasm uses clever wit, is aggressive, and often targets an individual. 5 types of laughter. Genuine or unforced laughter is often in response to a stimulus. Spontaneous laughter is often associated with a positive mood. Self-induced laughter. This is when you do something that makes yourself laugh. For example, if I'm a horrible cook and I take my cookies out of the oven and they're burnt, I might laugh at myself for continuing to be a horrible cook. Stimulated laughter is primarily physical and is not necessarily associated with positive emotions or feelings. So if someone comes up and tickles me while I'm crying, it doesn't mean that I'm happy. It just means they stimulated a response. Induced laughter is usually induced via medications. And pathological laughter is typically defined as a disorder of emotional expression due to damage of pathways in the cortex and brainstem. Laughter can be experienced both individually, for example when recalling a particular event, watching television or reading a book, or socially in groups, for example participating in a yoga laughter group or sharing stories with friends. So really there is something called laughter yoga. I encourage you to look it up on Google. Laughter theories. Although your textbook describes 9 different laughter theories, the field is dominated by 3 in particular, which I'm going to discuss here. Release theory, superiority theory, and incongruity theory. Release theory argues that laughter is the physical manifestation of repressed desires and motivations. Examples include nervous laughter and hostile humor. Superiority or disparagement theory posits that laughter is a means of increasing one's self-esteem at the expense of others. Proponents of this theory believe that laughter comes from the enhanced feelings of self-esteem or superiority that occur in responses to situations of others less fortunate. Laughter of this type gives people a sense of control over a situation and may be a key element in survival and coping. By contrast, incongruity theory states that humor is created by a sense of incongruity between 2 or more objects within a joke. Laughter in this type of humor occurs when a sudden shock, surprise, or conflict occurs. Many theorists believe that the concept of surprise is essential to humor. Currently, there is no concrete consensus on which theory is the most valid or complete. There are a few myths of humor and laughter. The first one is people need a reason to laugh. And when they do laugh, it must be for a good reason. Some people just enjoy laughing. That's their personality. When people laugh, they are happy. That's another myth. Because again, like the example I gave, if I was crying because I burnt my cookies again and someone came up and tickled me, it wouldn't mean that I was happy because I laughed. It's just that they got a response from me. And humor does not equal laughter. So someone can be humorous or someone can be not humorous, but they could still laugh. Physiological effects of humor and laughter. Laughter has physiological effects. It changes body chemistry and brain function. Laughter increases heart rate and respiratory rates, as well as oxygen consumption over a short period. After these initial changes, a person moves into a state of relaxation. While these effects may not be the equivalent to aerobic exercise, as some claim, that is not to say it is entirely without benefit of physical activity. 10 to 15 minutes of laughter per day may burn 10 to 40 extra calories. Laughter affects heart function. It increases stroke volume and cardiac output, and it dilates blood vessels. After intense laughter, muscle tone relaxes. Watching humorous videos revs up the sympathetic nervous system. However, this does not increase blood pressure. Laughter lowers the levels of the stress hormone, cortisol. Laughter activates the mesolimbic dopaminergic reward system in the brain. Laughter increases serum immunoglobulins A and E. In most studies, it seems to increase natural killer cell activity as well. It raises levels of beta endorphins, the feel-good chemicals of the body, and increases human growth hormone production. Health condition effects. Laughter and humor also have the following effects on specific illnesses. There is inverse association between coronary heart disease and propensity to laugh. Laughing more means lower heart risk. A 2018 study found that laughter therapy effectively delays cardiovascular complications of type 2 diabetes. Watching a comedy show decreased overall rise in glucose levels after eating. Higher propensity to laugh correlates with fewer episodes of arrhythmias and recurrent myocardial infarctions during cardiac rehabilitation. Laughter increases pain tolerance. Laughter therapy improves self-esteem and mood in cancer patients, according to a small 2015 trial. Watching a funny movie decreased bronchial responsiveness in people with asthma. Laughter and clowning reduced hyperinflation of the lungs in people with severe chronic obstructive pulmonary disease. Health condition effects continued. Hospital clowns reduce stress and anxiety levels in hospitalized children and their parents. Elder clowns reduced agitation and increased happiness in nursing home patients. Humor therapy, watching a 20-minute humorous movie, led to improvements in cognitive function, including learning ability, delayed recall, and visual recognition in a study that included 30 older adults. Cognitive improv training led to subjective improvements in symptoms for people with Parkinson's disease. A study of 30 people with schizophrenia found that 10 hours of humor skill training can improve rehabilitative outcomes and sense of humor, including change in negative symptoms. Laughter decreased inflammation as measured by pro-inflammatory cytokine levels in people with rheumatoid arthritis. Laughter and humor reduced reactions to allergens. Humor in healthcare. One method for putting laughter into practice is to discuss laughter with the patient during a visit. Providers can ask, "What has made you laugh recently?" or How often do you laugh? Inquiring about laughter opens the door to lightheartedness and also could lead to counseling on laughter and sharing the latest research with the patient. More important, it allows the provider to determine what the patient finds funny, thereby allowing the provider to tailor recommendations to better fit the patient's needs and preferences. This also contains the potential to deepen the therapeutic relationship between patient and healthcare provider. It is important to know when humor is appropriate with a client. Use the following criteria to determine if humor will impact your patient. Number 1, timing. Be sure to be mindful of the situation before using humor. For example, when notifying a client that they have miscarried is not the appropriate time for humor. Receptiveness. What might be funny at one time for a patient might not be funny at another moment in time. Content. Some content may not be suitable for children, the elderly, or religious. Humor in healthcare continued. Using humor in the healthcare setting must include kindness, compassion, and empathy. There are barriers to implementing laughter therapy in one's practice. Finding the time to discuss laughter, even just a 1-minute conversation, is understandably challenging. Benefits of humor are that it is free, no side effects, and it is readily accessible. Laughter also has the potential to significantly affect the quality of our work lives. Humor helps relieve tension, reassures people, and draws them together. It likely strengthens the bonds between patients and members of their healthcare team. It even seems to increase people's willingness to disclose, so it may help with obtaining good information during patient interviews. Laughter prescriptions. If you feel that your client can benefit from humor and laughter, write them a laughter prescription. I propose that laughter prescriptions might contain detailed information as to the frequency, intensity, and time and type of laughter, forming the mnemonic FITT, much like pharmacological prescriptions and exercise prescriptions. This format aims to give patients clear and easy to remember guidelines. It is also a way to present laughter in a serious manner. When prescribing laughter, it would be of utmost importance to individualize the recommendations, taking into consideration the patient's own sense of humor and willingness to engage in new activities, such as laughter yoga. An example of a laughter prescription is F frequency, once a week, intensity, belly laughing, time, 30 minutes, and type, your favorite sitcom. Laughter prescriptions remain largely speculative, but existing research indicates that efficacious laughter treatments typically occur once a week or less for 30 to 60 minutes. Ways to incorporate humor in your life. Laugh at yourself, especially if you trip and don't hurt yourself. Visit a comedy club or listen to a funny podcast. Replace negative self-talk with positive self-talk. Tell jokes. Collect funny material. One thing I like to do is when I'm driving and at a stoplight, if there's someone in front of me that has a funny bumper sticker, I like to take a picture of it and share it with others. Surround yourself with funny people. Develop a humor kit at home, or maybe you even develop one at the hospital or a clinic. Make time to play. Do you ever walk by a playground and remember like, oh, I used to love swinging or going down the slides? Well, who's stopping you? Go down that slide. Here are the references that were used to create this lecture. Thank you for listening.